She's the independent expert on the right to health appointed by the Human Rights Council in 2020 and warns that the conditions in Gaza today are incompatible with the realization of the right of everyone to the highest attainable standards of physical and mental health.
Not only is Israel killing and causing irreparable harm against Palestinian civilians with its bombardments and their allies, they are also knowingly and intentionally imposing famine, prolonged malnutrition, and dehydration. I remain concerned at the ongoing risks of water and airborne diseases, lack of medical and surgical supplies and commodities, and the lack of sexual and reproductive health and mental services. The many complex injuries and resulting disabilities and complications created as a result of the type of military arsenal used puts disability rights also into focus.
She argued that Gaza's medical infrastructure was irreparably damaged just days into the over 6-month conflict, and that as a working medical doctor, she's witnessed the very practice of medicine being under attack. Dr. Mofokeng's damning assessment comes amid reports that mass graves have been unearthed at the Nasser Medical Complex in Gaza's Khan Yunis, just weeks after Israeli troops withdrew from the southern city. Estimates put the body count at close to 200, while mass graves were also reportedly discovered at the Al-Shifa hospital complex in the largely destroyed north. Dr. Mofokeng called for leaders within the multilateral system, regional blocs, academia and civil society, among others, to abandon what she describes as a self-imposed passiveness or quiet diplomacy.
The number of widespread violations of the special protection afforded to civilians, including the horror that children are specifically subjected and exposed to, and violations related to lack of protection of medical personnel under international human rights law and international human rights law humanitarian law has been immeasurable. Despite international calls and demands for an immediate ceasefire, the shameful war continues, and Israel's allies continue with the despicable acts of international cooperation in ways we've never seen before, and supporting to occupying in a regime with billions of dollars in aid, weapons, political power, and cover from accountability.
She also highlighted the psychological trauma inflicted on the population after months of military bombardments, damage she believes will be intergenerational.
We see the physical injury, and because it's physical, one can appreciate the severity of it. But the acute mental distress that will then turn into anxiety and other kinds of mental illnesses later on in life is really, really important to start thinking intentionally about. And all of the support should be accompanied by psychological and mental health practitioners who are specifically, with expertise to support in these kinds of contexts. Imagine living under the constant anticipation of a bomb, of a gun, of being shot while you're trying to get food or water or play. That is in itself a form of violence, to anticipate that your life could be distinguished in any moment. And for children to grow up with that level of trauma is not normal.
Emphasizing that the current state of Gaza was completely incompatible with the right to health, an issue Dr. Mofokeng wants at the front and center as the power brokers struggle to resolve this moment of crisis. Sherman Riceby's SABC News, New York.
Now, the UN Secretary-General has accepted the recommendations contained in an independent review group's report into the operations of the UN Relief and Works Agency for Palestinian Refugees in the Near East. The review, chaired by former French Foreign Minister Colonna, working with 3 European research institutes, was addressed and established to assess whether UNRWA was doing everything within its power to ensure neutrality and to make recommendations to improve and strengthen work in this area, if necessary. The review commended soon after Israel leveled untested allegations against several UNRWA staff, accusing them of colluding in the October 7th Hamas attack. But these claims did not form part of this panel's review.
The review found that Israel had never expressed formal concern about anyone on UNRWA staff lists that it received annually, And while not mandated to verify the allegations of terror links by UNRWA staff, the report states that Israel is yet to provide supporting evidence to its accusations that led to key donors suspending funding of around $450 million.
In the absence of a political solution, we know it provides life-saving humanitarian aid and essential services to the population. And of course, as we speak in this critical time, UNRWA has a vital role in the humanitarian response in Gaza. Overall, the findings of the review are that UNRWA has in place a very significant number of mechanisms and procedures to ensure compliance with the humanitarian principle of neutrality. Actually, they probably have a more developed system than other UN organizations or agencies, which is a necessity considering the very difficult environment, complex and difficult situation in which they operate, and the uniqueness of their mission. There's always room for improvement, and some issues related to neutrality persist.
The report makes 8 recommendations in a number of key areas, including greater engagement with donors to enhance transparency and address the trust deficit, strengthening governance structures in support of leadership, enhance management and internal oversight, the neutrality of staff in an agency that faces challenges of politicization among workers, neutrality of installations in the context that UNRWA facilities are sometimes misused for political or military gains, neutrality of education that upholds UN standards, the neutrality of staff unions, and the need for enhanced cooperation with all UN agencies to help ensure delivery of life-saving humanitarian operations in Gaza.
I would like to stress that the international community has a responsibility in helping and supporting UNRWA in addressing neutrality issues, globally speaking, in its mission, including in helping the agency to address these difficult challenges it faces sometimes. It is a shared responsibility. We have recommendations for governance without changing the mandate. It is what it is, and the structure is what it is. I recommend the Advisory Commission to meet more regularly, maybe at a higher level, sometimes at the UN headquarters, here in New York or in Geneva, why not, at the level of permanent reps. I recommend to have neutrality as a standing issue on its agenda.
The UN chief has pledged with the Commissioner General of UNRWA to establish an action plan to implement the panel's recommendations.
The Secretary-General accepts the recommendations contained in Ms. Colonna's report. He has agreed with the Commissioner-General, Philippe Lazzarini, that UNRWA, with the Secretary-General's own support, will establish an action plan to implement the recommendations contained in Ms. Colonna's final report. In this regard, the Secretary-General counts on the cooperation of the donor community, the host countries, and the staff of UNRWA to fully cooperate with the implementation of the recommendations. Moving forward, the Secretary-General appeals to all stakeholders to actively support UNRWA as it is a lifeline for Palestinian refugees in the region.
A separate investigation into Israeli allegations that 12 UNRWA staff supported the Hamas attack on October 7th has yet to be completed by the UN Office for Internal Oversight Services. Sherwin Ricebees, SABC News, New York.